position. I like to do these in front of a mirror, if at all possible, so a patient can see that my head is upright, that I am level, my eyes are on the horizon. So think about all of our motions. So everybody sit up nice and tall, put a couple of fingers on your forehead, and push directly back into your forehead, and resist flexion. Okay? It's not as strong as our manual muscle test, but it's very gentle. Press. Okay, we can take a hand behind our head, resist, extension. Hold it a few seconds, and release. We can take hand to the side of the head and resist lateral flexion. So you're trying to laterally flex, but your hand is stopping you. Okay, we can do it on the same side, or opposite side. We can resist rotation, so same basic position, only now I'm trying to rotate, but my fingers are going to resist rotation. Okay, I'm going to resist rotation. So you can say just look with your eyes, don't let yourself rotate. So very basic isometrics. And just a soft press, gentle hold, 5 seconds or so, just to engage muscles and then release muscles. Sometimes your muscles are so tense that they don't realize that they're on and you don't realize that they're on, and so just giving a little isometric push is enough to break it because it has to contract more, and then you think about releasing. I've contracted, now I think about releasing, and that will shut the muscle down. Okay. Isometrics are great. Posture correction against the wall. We talked about the lumbar spine as well, that we can put somebody up against a wall and flatten out their low back. Well, we can do the same thing with the cervical spine. Park somebody up against the wall. If I'm back against the wall, I'm going to do my chin tuck. My head should be back against the wall. Okay. That gives your patient that tactile feedback that I'm pushing back against the wall. If their head is normally 3 inches from upright and they have to pull it back, feel the wall, oh wow, that's back there a ways. I'm really off. If it's somebody who is kyphotic, so my elderly folks that are kyphotic, I will park a chair up against the wall and put a pillow between their head and the wall and have them just try to push back to the pillow. That gives them some extra padding for one, and it also gaps that space. If they're kyphotic, there's no way they're going to get their head back against the wall unless they really extend, and that's not the position that I want them to be in. I want them to pull back, more of a cervical retraction, just pulling straight back against that pillow. So all of these have some sort of a component of biofeedback. You need some sort of a tactile cue. Putting someone in front of a mirror gives them that visual cue. You touching them gives them a tactile cue. Postural muscles really need those constant tactile cues. We had a Undress the Stress program here, Wendy Simmons runs, and for all the employees there are different things that they do, and most of us who are at all into our jobs have a tendency to sit at our desks and work through lunch, or we get going and we get tunnel vision and hours will pass and we're still typing away on Moodle, we're still on email, and we don't break that cycle and get up and move. And there was some great software when you signed up for this program. They sent you the software to go onto your computer, and every hour it rings, and this little person comes up and tells you it's time to stretch. And there are little programs you can choose. You can choose certain ones, or it just has a basic program, or you can just set it so it just reminds you. And I'll have people with watches that will beep on the hour. I'll say, turn that on, turn that function on. Every hour that beeps, you need to do your neck exercises to get yourself in a good position and check. So anything that you can do to help remind. I've threatened to come up with some sort of device that clips on you that's my voice that tells you every hour to do something. But I hear from students that happens anyhow. So when they're out in clinic, they hear me talking to them all the time. But anything that's giving you reminders is really good for these cervical and postural muscles. The slow-mo ball range of motion. So we don't have a slow-mo ball. That's just the name of one brand. But if you remember those balls when you were kids, they'd have a big cage with a whole bunch of little kind of cheap plastic balls that might have Spider-Man or flowers or different colors. They were, a lot of them were tie-dye or swirly looking. Well, this one's just a little soft, squishy ball. It has little cilia on it. You don't need these. But just a ball that's partially deflated. Okay, a soft plastic ball. It can't be one of the hard, it can't be a basketball or a volleyball or anything, but something that's soft. You can have someone lie down on it. And this will be kind of like our half foam roll was for the ankle. So this cushions and cradles my head, but it will allow me smoother movement. I can work on my rotation. And I'm just rolling side to side on this ball. But at the same time, it's making me strengthen and work range of motion because I have to control it. If I didn't, I'd just fall off to the side. So I'm engaging my stabilizing cervical muscles to help control, and all the while this puts me in a chin tuck position, so I'm not really able to get out of that chin tuck position. So this is a nice, gentle way that someone can do some strengthening and stabilizing exercise. Just get one of those little cheap kids' balls and deflate it part way. Some of the clinics I've worked at, they actually have ones in the clinic that will sell. Those were called slow-mo balls, and they were plastic, and they had just a little straw that you could blow into to inflate them. And so just half inflated, cradles the head, assists your range of motion and your stabilization. Okay, so for some intermediate exercises. Now we're looking at the chin tuck with cervical flexion. So we differentiated this morning about your chin tuck being upper cervical or capital, and then your full flexion, bringing the chin all the way to the chest. So if I start a patient with cervical stabilization just doing the chin tuck, I don't want them to lift their head up off the table at all. I just want them to do the chin tuck. Okay? But once they get pretty good at the chin tuck, now we have to make it more functional, and we actually have to add a little resistance. So the way that we can do that is have them then start in some chin tuck and then initiate lifting off the table. Okay? So start with the chin tuck. And then I'll tell them, all I want you to do is unweight the head. I don't actually want you to lift it off the table, just unweight. If they can do that, 10, 15 repetitions, now I want you to lift the head off the table. Okay, now I might want you to chin tuck and try to lift your chin towards your sternal notch. Okay, if you can do that, now let's try to lift more towards the whole sternum. So you can break it down into little bits and progress through all the different range of motion. Okay? But always start with your chin tuck, because we need to get the chin, the head, the whole skull lined up properly on top of your spine before we start adding the curls. Patients will call them neck curls. Neck curls. Okay, but we need to start with the chin in the right position before we do that. Okay. Towel resistance for all planes. So just like we did with our hands, doing isometrics, we can take the towel and resist ourselves. So get in your nice position here with your chin tuck. Now I'm going to push back into the towel, pull with my hands, so it's just an isometric there with the towel, so it's a little harder. And then you can also go through some range of motion, but giving yourself some of that mild eccentric resistance through your range of motion, flexion and extension. Okay. You can do the same with rotation. So I can resist rotation with my towel, and I can also give some eccentric resistance through some range of motion. Okay, same thing with lateral flexion, I can give some resistance. So by using the towel, that frees up your hands just a little bit. You're not just pressing with your fingers, and you're able to resist through that range of motion. Okay, so then for extension, same rules apply as far as the chin tuck position and such. Your manual muscle test for extension was in a prone position. So you can actually just have someone prone on elbows and just work on lifting their head up. So you can start with a retraction and just say, all right, just lift up. If they're not able to fully get in prone, you can just have them on the counter. And I'll have somebody on the counter and say, all right, just let your eyes hang down, and I just want you to lift straight back. Straight back. And then we can work on to the full extension. So now we're going to lift straight back, and then I want you to look up towards the ceiling and back down. So straight back, now look up towards the ceiling. Okay, so if someone can't get prone, you can just have them lean over the counter in a good position and work on that. But break it down into small steps that they can control. And again, we want to start with that chin tuck or that retraction first. All right, so the wedge eccentric. I really like this exercise. Let's see, where do we have it? They make smaller versions of this that are just the foam that don't have the vinyl on top of them, and they make them in different degree angles. This one will work just fine for what we're doing. So remember when we did calf raises, and we talked about doing eccentric exercises that we can go up on both and then slowly lower down and work on eccentric, how much control it takes to do eccentric, that it's a good exercise. We can do the same thing with cervical. So if I were wanting to work on some rotation, so if I'm on this wedge and the right side is higher than the left side, what's that going to do to my head, or want my head to do? It's going to make me want to rotate to the left. If I lift my head from the left into right rotation, I'm going to lift uphill concentrically, right? If I control my head downhill to the left, I'm working eccentrically. So I will have a patient lying in hook lying and put the wedge underneath them, and I, as the therapist, will hold their head in neutral and then say, all right, when I let go, I want you to slowly let your head roll to the left. Keyword, slowly. Okay, we get down to the bottom. I lift them back up again. Slowly, lower to the left. I lift them back up again. Or, when I'm doing myself, I can train them to use their own hand and lift up, and then slowly lower down. And then to work the other side, I would move the wedge the other direction. Okay? Once they can control that eccentric, now I can have them start working uphill. I may start with a smaller wedge, not quite as high, and say, all right, now I'm going to have you go uphill. So now you have the hard job. You have to roll uphill. And then slowly lower it back down. Now you're rolling uphill. Alright? So you can do eccentric. You can put them in position. You can teach them to put themselves in the position to do eccentric. Then you can have them start working uphill. Okay, so they make these wedges. If you work in an outpatient clinic, you might have some in the clinic, and you either check them out to a patient to borrow for a while or sell them to the patient. Or I have patients use the heavy-duty 3-ring binders, the thicker ones, and I have them put something inside there, rolled up towel or something like that, towards the rings, just to fill it out so their head's not bending it. The cheap ones don't work all that well, but some of the heavier duty ones. So I can have them start with it filled out pretty far, so there's a smaller angle, and then we can start taking some of the filling out of it so they're at a higher angle. That works well. You can also use a pretty hardback book and prop it up on one end, so a towel or something, and create your own angle. So that works. I like cheap home fixes, things like that, that'll work. So that way you can work on eccentric, and then you can switch to concentric, working on that rotation. Because your body's going to have to relearn, especially after some sort of an accident, a car accident, something like that. Those things are lingering. Whiplash, they take forever to heal. All right, foam roll vertical. What are we doing on time? Not too bad. Let me skip the foam roll for a second, and then we're going to come back to it. There's nothing going on next door. I see a whole rack of foam rollers here. I want every one of you to get on foam roll and lie on it for a couple of minutes before you move on to your next activity. So I will come right back to that one. The pin light or laser stabilization. So stabilization is huge. We need to be able to hold our head in a good position as we do everything through the day. So we can work on these exercises, we can do everything right, and then we go out and do our activities and our body switches back to its normal bad habits and patterns. So we can train someone to hold the head in the correct position using a little pin laser. You can have, we use a couple of different ways, a headband, and you tape the laser onto it. You can use use what I told you we use in the clinic as far as the inside of a hard hat type of apparatus. We've used that. There's a strap that goes across the top. We've Velcroed a pin light to the top of it. And then you can have your patient focus in on something. So I would put a Post-it note, or maybe I'd start with a regular sheet of paper and I'd put it up there. And I would have my patient focus on that. So I'm going to say, Brittany, you are my focal point. You're my paper. So if I'm walking, I'm going to keep that laser on your face. My goal as the patient, I can't let my laser focus anywhere outside of the parameter of your face. So I would walk towards you. I have to keep looking at you. Don't let the laser go anywhere. And then I have to walk backwards. Or I have to do some other motion. I had a bowler one time. Crazy neck problems. That's what we did. That was our treatment session. We put the laser light on. All right, I'm in my bowling position. I have to go through my bowling motion, still keeping my laser within that paper perimeter. Then as they got better, I made the paper smaller. As they got better, I made the paper smaller until we were at a Post-it note. Okay? So we can work on that, and it's fun. It's infuriating at times because you look and you do something and then I've lost it. But it's really effective because how else can I make you as the patient realize where you're looking, where your head is facing? So I can do something like that, put a laser light on you, have you go through a motion, and you have to keep that laser light focused in on a certain target. So that works pretty well. And like I said, then you can add in the patient's own activities and say, all right, well, here's what's going on. We do all this work, then you go bowling, and then it all goes to mush. So let's work on this while you're doing those activities. All right, Brian, you said you were going to demonstrate our neck bridge. So very rarely, again, just like with everything else, very rarely do we get to a point where we're doing really, really advanced exercises for the cervical spine. One time I had a high school wrestler, and he had to be able to do a neck bridge and not have pain. So we worked on him, got him stable, we worked on him, he still kept trying to wrestle, still kept getting pain. We had to keep upping his exercises to something that was functional for him. So we did a neck bridge. You don't have to. So we had him on a ball.